Hello, this is Dr. Jackie with Searchlight Healthcare Advocates, bringing you another episode of Let's Get Real with What's Wrong with Healthcare. This is a series that discusses real client issues or problems that they have in using healthcare with the purpose of offering information, potential fixes, and to really create a forum for dialogue to try to help other people troubleshoot with getting the healthcare that they need. On this episode, we turn our attention to Medicare, and this is part one of a three-part series. This first part is focusing on the silver tsunami, which is the largest section of the baby boomer population that are about to turn 65. So if you are about ready to turn 65 in the next year, this video and podcast is designed specifically for you. Medicare has become super complicated. It used to be a program run by a single payer, the government, and while the government still pays for some of that, they have opened that to the open market, and just about every healthcare insurance company offers some sort of Medicare product. So today we are turning this over to Dylan Murray with Brightstar Insurance, who specializes in Medicare health plans, to help us understand how you go about selecting your plan at the age of 65. Because if you choose your plan incorrectly, it could actually cost you more money, and it may not provide you with the services that you need. Dylan, welcome, and thank you for offering your expertise today.
Hi, Jackie.
Can you explain the alphabet of Medicare?
Yeah, the alphabet soup. First, I do want to just make my disclaimer.
Sure.
And my disclaimer is that I don't work for the Centers of Medicare and Medicaid. I'm an independent broker. And licensed.
So the Centers of Medicare is the official government name for the Medicare program.
Right. CMS.
Yes.
So the alphabet soup. So typically when you're talking about the alphabet soup, you have your parts, Part A and Part B. Part A is hospitalization. Hospitalization in general just refers to the bed, the nurse, the pillow, the building. And Part B is medical coverage. That typically refers to the doctors that are coming in and seeing you, procedures, those kinds of issues. So those are your parts, Part A and Part B. Those are your core parts. Then you have Part C, which gets complicated, and Part D. Part D is for drugs. Those are your four main parts, A, B, C, and D. But a lot of people hear about F and G and N and K. Well, those are plans. So you have to make sure that you understand that there's parts and plans. So plans are what sort of fills in the gaps that your original Medicare doesn't cover. So you can have, one of the more common plans to have is the F plan. F plans pretty much cover everything that original Medicare doesn't cover. F plans don't include drug coverage. That is all part of D. But that's, that when you're dealing with what do I need and what do I have, you have to keep in mind that those are the points to remember. Are we talking parts as far as original Medicare, or plans, which are supplements to fill in the gaps?
So you talked about Plan A covering the hospital expenditures and B being like the services part of it.
Hold on. You said plan.
Oh, sorry.
Those are parts.
This is why it's complicated.
That's right.
So on the Part B, is that also covering outpatient visits in doctors' offices?
Yeah, so a lot of people think to themselves, well, hospitalization is entirely covered. So when I'm in the hospital and the doctor comes and sees me, it's covered. See, Part A is covered at 100% by Medicare. Part B is only covered by 80%. So they think, well, if I'm in the hospital and the doctor visits me, it's covered 100%. No, it's not. Because as soon as the doctor walks in the room, your Part B is what's being billed, not your Part A. Your Part A is your hospital bed, your nurse, your pillow, your blanket, your TV. It's the physical facility of the hospital. Anytime a doctor is involved, it switches over to Part B. And that's why people think to themselves incorrectly, like, oh, well, it's not going to be that expensive for me to go to the hospital and have my heart attack. I don't need anything other than original Medicare. Except, if you have 6 different doctors participating in your care inside the hospital, that's all Part B. So your outpatient is also obviously covered by that Part B. So you go to visit your primary care doctor or your cardiologist at his or her office, that is Part B. And that's what's covered 80%.
So that brings us to the question of, what is regular Medicare mean versus all the new choices that are available on the open market?
So what happens when you have parts A and B, and as I've said, that kind of covers about 80%. A is covered 100%, B is covered 80%. So, 80%, back when Medicare was originally created, nobody thought to themselves, well, 20% of a medical bill is going to be $100,000. That would be absurd. But that is really the case today. And they thought, well, drugs aren't ever going to be that expensive. We don't have to worry about drugs. That's why Part B only covers 80%, and that's why they didn't include drug coverage. Because why would you need to do that back in 1965? But it's not 1965, and those costs are out of control. So you need to think about those 2 different factors. How am I going to pay for that other 20%, and how am I going to cover my drug coverage? How am I going to cover my drug costs? And it really boils down to, most of the time, 2 different choices: supplements or advantage plans. Supplements are those plans that we talked about, like F. Other common ones are G and N and K. So those supplements are, you pay for them every month, and they cover a lot of the gaps. A lot of people are familiar with the F plan, because the F plan is a supplement that covers 100% of whatever Medicare doesn't cover, as far as excluding drugs. So a lot of people love the F plan because they go to the doctor, there's never a copay, there's nothing like that, they never get a bill that they have to pay. Great, and they pay a monthly cost for that. Mm-hmm. It's kind of like paying up front. The alternative to the supplement is the Advantage plan. Advantage plans are typically low to no cost per month, but that has a trade-off. That trade-off is that you usually do have copays, and you have to stay inside of a medical network. So that's...
And when you say medical network, you're talking about within a specific medical group, or are you talking about that this is a typical HMO, or is there also the tiered system of HMO, PPO, POS?
No. So Advantage plans are 95% of Advantage plans are HMOs.
Okay.
There are actually a couple, and my point of view is from Southern California, and all of the different plans operate county by county, but there's not a whole lot of PPO Advantage plans out there. They do exist, but there's not a lot of them. Most Advantage plans are just HMOs.
So if I caught on to what you were just saying, that traditional Medicare, the money's being extracted right out of your Social Security check.
Right. And
that's an immediate deduction. And then you have your Advantage plans, or you have a supplemental, which are still the parts. Part F. Plan F and G.
Yep.
And those are also a fixed monthly cost for those, but that will cover what Medicare won't pick up.
Right.
But there's the caveat that Medicare has to cover it in order for it to pay.
Well, there's always that. So that the underlying theme here is that basically Medicare has to agree that this is a medically necessary procedure, and it will therefore if it's covered by Medicare, it'll be covered by the supplement that you have.
And so if I also caught on what you were saying about cost, is that I can think of several clients who have multiple chronic diseases, which means they have multiple physician visits. Every month they're seeing their team. It could be 4 or 5 different physicians within, a month to 6 months. So that would mean in those plans they would have a copay every time they would see those physicians.
Yeah, that's correct. So if you have an Advantage plan, then every time you visit the doctor, you have a copay. It can be as little as $5. There are some Advantage plans that have $0 copays, but many of them, especially based on the county, we happen to be in San Diego County. We have a lot of copays in San Diego County because we have higher cost of healthcare here. But yeah, every time you visit the doctor, there's a copay, and that can be a challenge. If you visit the doctor twice a week because you have several chronic problems, you're paying out up to, say, $40 a visit, and now you've paid, $80 a week times 4 is $320 a month. That's a lot of money. And yes, Advantage plans will cap off the amount of money that you have to pay out of pocket. Mm-hmm. But when you balance that against the fixed cost of a supplement plan, it can be significantly less if you know going in that you already have a significant number of medical concerns. The supplement plan actually can save you money even though you're going to be spending several $100s a month. Everything's covered with the F plan, so you don't really have as much insecurity about the cost.
So one of the things that I noticed when I was in practice, when somebody would call to make an appointment, was their first question was always about cost, which is really sort of our industry has created a retail mindset with people seeking health care. And what I'm hearing from you is that for a senior who is on a fixed income, cost is a component of that, but it's beware of what you're purchasing because you may not get the services you need.
Yes. And
so one is there's no such thing then as a no-cost Medicare plan.
Oh gosh, no.
Okay. So when our viewers and listeners out there are set to turn 65, how should they go about choosing a plan that will balance the cost versus what services they really need to take care of themselves?
So one of the mindsets that people have, and I think that there's a baby boomer mindset that is really admirable, which is, I'm going to figure this out. I'm going to get down to the bottom of this because I can do it. And the truth is, it's not really something you can do if you're not experienced, if you're not already a health insurance Medicare approved broker. No, there's an unknowable amount of information because the plans change every year. The insurance companies have different policies every year. Prices change every year. Medical groups change every year. There's no one way to just figure this out. So when you say, how do I pick the right plan when I'm turning 65? You don't want to do it on your own. The difference, I like to make the analogy, is like when you're 18 and you've had a job at McDonald's. Great. You can probably do your own taxes on that EZ form. It's not that big of a deal. You just do it. By the time you're, say, 50 and you own 2 businesses and you have a consulting job and you own a home and you have dependents, you just want to bring in a tax guy because he's going to solve a lot of problems that you aren't going to even know to ask the question. The same is true with Medicare. When you're 22 and you're super healthy, whatever, your health insurance almost doesn't matter because you're healthy. But by the time you're turning 65 and you're developing health problems, you know what? And I know this is shameless self-promotion, but you really need a broker to be able to understand what your specific needs are, the system is overly complicated. That allows for a lot of individualization, which is great, but you can't really do that individualization because there are questions that clients don't even know they need to ask, and loopholes that exist that you don't know that you might want to take advantage of or avoid. So with that level of unknowable information, the best thing to do when you're turning 65 is call a broker, like me.
This episode will continue on a podcast with the information available at the end of this screen.